I think in a doctor's hospital, what sets us apart is that we have highly trained first world doctors. We have a high-end oncologist. We have all the relevant pre-diagnostic tests that you need. So there's so much in diagnostics that's important and relevant. It's the blood tests, it's the clinical exams, it's what radiology brings to the table. We do have the Breast Cancer Awareness Month, so mammograms are one of the classical examples where you look for cancer in a hopefully healthy population and try to find cancer very early. Early detection is the trick in everything. We do the same with lung cancer. We do CT lung cancer screening, and that has shown incredible new results in getting patients earlier onto the right track.
I'm proud of the Doctors Hospital Oncology Services, which I'm the clinical director, because we offer to our patients all kinds of contemporary medical oncology treatment modalities, such as chemotherapies, immunotherapies, targeted therapies, and hormonal therapies. We manage our patients in line with the current US, British, and Canadian treatment protocols and guidelines, so that to offer to them quality individualized treatments and at the same time to ensure the best outcome for them and minimizing the chemotherapy-related adverse effects.
Sometimes the patient might be overwhelmed or they might be frustrated, but just understanding and accepting that that's part of the process, and I think providing them with information and making them feel comfortable that they're not walking into the unknown, giving them as much information as possible, and then also just letting them know that we're here for them. You can always contact us if anything comes up. So just preparing them as much as possible, and then letting them know that we're here for them every step of the way to get them through this difficult time. It provides a level of stability in a very uncomfortable and unstable time in somebody's life.
I've dealt with colon cancer and breast cancer. Colon cancer in particular is something that I'm particularly interested in. And simply because I feel like we can prevent colon cancer. I do a number of colonoscopies a year, and I've found cancers in polyps as small as 1.5 centimeters. That's less than an inch. And we've been able to remove those, and the patient doesn't have to deal with any chemotherapy or another operation. So in this case, an ounce of prevention is worth a pound of cure.
The team dynamics of our resident surgeons who apply that surgical oncology aspect to those kind of patients when the options are available. One of the advantages as well is there's that synergy among those specialists, and we have aligned ourselves with Baptist very strongly to offer radiation oncology. So we see the patient not just as a diagnosis, as I said before, but we see them as someone who requires intimacy, requires convenience, requires the ability to provide care and support and nurturing.
This allows Doctors Hospital to offer a unique blend of expertise and experience in oncology that represent the best out of what those great medical schools have to offer.
One of the things that I find most impactful and personally touching is when a patient comes to the end of their chemotherapy treatment course. So sometimes that can even be up to a year. So you can imagine how happy that person would be to be finally on the other side of this, you know, difficult journey. And just to be there, we generally have a celebration for them. And just to be there and share in that experience, I find to be very impactful, and it's one of the reasons that I love what I do.